The world of healthcare, well, it really is undergoing a massive transformation, isn't it?
It certainly is. Quite profound.
It feels like it's shifting, I mean, driven by technology, obviously, but it seems to be impacting, well, everything from the big picture, the strategic vision of hospitals, right down to the really personal moments of patient care.
That's right. It's technology, operations, and critically, people. All interwoven.
Exactly. It feels like a really complex web. So today we're taking a proper deep dive into this evolving landscape. Now, our source material for this, it's a really rich collection of research insights, all exploring exactly this intersection you mentioned. We've got studies looking at Kerr, the concept and the reality of smart hospitals, which sounds fascinating,
Hmm.
the dynamics of innovation procurement, how hospitals actually buy this new stuff. Then there are these radical shifts needed in people management, HRM 4.0, some are calling it.
Yes, that's the term being used.
And the intricate dance of managing flows in healthcare, both the physical things like medicines and the intangible flows patients themselves.
Absolutely key.
Plus, how digital tech like AI and telemedicine are actually being used on the ground. And maybe most importantly, how quality is seen from different angles, the patient versus the professional.
Very different perspective sometimes.
So, our mission today is really to cut through all that complexity, try and extract the essential knowledge you need to really understand this critical evolution. And joining me to guide us through these, frankly, fascinating insights is someone who really excels at this synthesizing diverse information, spotting the crucial patterns, and providing that necessary context to understand what it all actually means for healthcare's future and for everyone working in it.
Thank you. It's a real privilege to delve into this material with you. As you say, it's a transformation that's technological, yes, but also operational and, well, deeply human. Understanding that interplay is absolutely key.
Right, absolutely. So let's just dive straight in then. The sources, well, they kick off by looking at this whole idea of smart hospitals. Sounds a bit sci-fi maybe, but the research seems pretty clear. It's actually a strategic thing for right now, isn't it?
Oh, definitely. Very much so. Strategic and highly relevant. The way the literature frames it, it's not just about, hospitals packed with gadgets. Although technology is central, it's seeing them as strategic entities where the latest tech is really woven into brand new processes, totally new ways of working, actually.
So a fundamental redesign.
Exactly. A redesign of how healthcare gets delivered, how it's managed. And it's crucial because, well, the pressures on systems everywhere are just intensifying.
Okay, pressures. What sort of pressures are really driving this urgent need for change? Is it just the speed of technology itself pushing things along?
Technology is certainly a major catalyst, yes. There are references to authors who all point to this expectation, this reality that rapidly evolving digital tech is set to disrupt healthcare globally. But it's not just that technological push. There are really significant external pressures and changing demands acting as powerful drivers, too.
Okay, could you elaborate on those a bit? What specific demands, what challenges are pushing healthcare towards this, well, smart way of doing things?
Well, the forces highlight a definite growing demand for outpatient services, ambulatory care, as it's sometimes called. People want care closer to home, outside the traditional hospital walls, especially for more routine conditions.
Makes sense.
But at the same time, those patients with really complex or severe conditions, they still absolutely need that intensive high-tech inpatient care. So you've got this dual demand pulling in different directions. It creates a real logistical and operational headache.
I can imagine a balancing act.
Precisely. And compounding all this is the demographic reality of an aging population. Older populations, generally speaking, have more complex chronic health needs. And actually, the increasing burden of chronic diseases more broadly, things like diabetes, heart disease, respiratory illnesses, that puts immense strain on resources.
Right, those long-term conditions that need ongoing management.
Exactly. And all these factors, when you combine them, inevitably lead to increasing healthcare expenditure. That's flagged as a major global concern.
So we've got rising demand, more complex patients, spiraling costs. Quite the perfect storm. How does this smart hospital vision, as the sources describe it, offer a way through all that?
Well, fundamentally, it forces a shift in philosophy. The sources are really clear on this. The system is moving, or needs to move, from that traditional provider-centric model where the hospital, its buildings, its internal workings were the main focus, towards a truly patient-centric model.
Patient-centric, we hear that term a lot. What does it mean in practice here?
It means the patient's needs, their actual journey through the system, and crucially, their overall health outcome become the central organizing principle. It's a pivot towards outcome and value-based care. Less about just performing a service, ticking a box, and more about achieving the best possible health result for that individual efficiently and effectively.
That reorientation sounds, well, huge. Does the research give us any concrete examples, projects that really embody this patient-centric, tech-driven approach?
Yes, it does. They offer a couple of quite illustrative European initiatives, actually. One is called EURIFI. That stands for European-Wide Innovation Procurement in Health and Care.
Okay, innovation procurement, what does that involve?
Essentially, this project promotes using new, innovative ways of buying things within healthcare, all done through what they call a community of practice, a COP.
Mm.
The idea is to work together, collaboratively, identify the unmet needs, the gaps, the shortcomings in current systems, and then use those procurement processes strategically to drive innovation that specifically addresses those needs.
Right, so using purchasing power to actually shape the solutions.
Exactly.
Hmm.
And the sources link this directly to the smart hospital idea by stating that smart hospitals see knowledge as the primary asset for the healthcare ecosystem. URIFI really exemplifies this. It's leveraging collective knowledge, shared platforms, innovative buying methods, not just to acquire tech, but to drive systemic improvements that ultimately benefit the patient. It's knowledge-driven transformation.
That makes sense. Knowledge as the core asset. And the other example?
The other one mentioned is big metalytics. This initiative is all about harnessing the power of big data technologies, specifically to improve patient outcomes and boost efficiency right across healthcare settings.
Ah, big data. We hear so much about its potential. What specifically is big metalytics trying to achieve in healthcare with it?
Well, it's described as being pretty central to how smart hospitals work, their dynamics. By applying big data analytics to these vast data sets, which could include really detailed patient journey information, the aim is tangible benefits. Things like cost reduction, better patient outcomes, and improved access to healthcare, whether that's inpatient or outpatient.
And the privacy concerns, that must be huge with health data.
Absolutely. The sources are very careful to stress the crucial importance of maintaining security and privacy when you're dealing with sensitive personal health data on that kind of scale. It's a massive consideration. But these projects, EURIFI and Big Metalytics, they really show that this shift isn't just talk. It's being actively pursued through large-scale collaborative efforts using new methods and powerful tech.
So the vision is becoming clearer, patient-centric, data-driven, innovation-focused. But of course, making any of this happen relies entirely on the people within the system, doesn't it?
100%.
How is this digital transformation reshaping that human side, particularly how we manage people in healthcare?
This is an absolutely critical dimension the sources really dig into. They argue quite strongly that introducing new tech isn't just about getting new tools. It actually imposes radical changes on people's roles and, crucially, how they're managed within healthcare organizations.
Radical changes? Like what?
Well, think about automation taking over some administrative tasks. Think about how collaboration and communication are increasingly happening virtually. And think about the sheer speed at which new services or protocols can now be created and rolled out. These factors are creating entirely new ways of working, which brings opportunities, yes, but also potentially quite significant threats if it's not managed well.
So does this mean the old ways of doing human resources, traditional HR, are becoming, well, obsolete?
The sources actually trace an evolution here. They talk about the shift from traditional HRM, often quite fragmented, focused on individual HR practices in isolation, to what became known as Strategic Human Resources Management, or SHRM, which really took off from the 80s.
SHRM, right. What was the key idea there?
SHRM is all about explicitly linking HR practices to the overall strategy of the organization, focusing on broader outcomes. It draws on ideas like human capital theory, resource-based views, takes a multi-stakeholder approach, and really emphasizes building a culture of trust.
Okay, so aligning HR with strategy, and then came digital HRM.
Exactly. Digital HRM focuses on using technology to make HR processes themselves more effective, better data collection, exchange, control, that sort of thing. But the sources argue what we're seeing now, this era, represents something even more profound, a digital disruption pushing us towards what they term HRM 4.0.
HRM 4.0. Okay, what makes that different from just digital HRM? What's the 4.0 bit signify?
It's characterized by the transformative power of digital technologies. It's not just about using tech for existing HR tasks. It's about leveraging digital tech to fundamentally reshape the design of new services and products, and even the very structure of the organization itself. The sources describe this as a fundamental strategic change of the entire organization. Technology becomes a driver of strategy, not just a supporting tool.
Wow, that's a much bigger deal than just rolling out some new HR software.
Much bigger.
So how does this translate into, say, a practical framework for healthcare? Is there a model proposed?
Yes, the sources introduce this concept of an integrated people management model, IPM 4.0. It's built on three guiding principles: sustainability, viability, and accountability.
Okay, IPM 4.0. And the core idea.
The core idea is that for this whole transformation to actually work, there has to be what they call a symbiotic and complementary relationship between the technology and the people. You can't just parachute technology in. You absolutely have to simultaneously think about how people are managed, supported, integrated into these new ways of working. Success really hinges on making sure that the tech deployment is tightly aligned with the people management strategies
Yeah.
and with the overall business strategy of the healthcare organization.
Technology and people strategy evolving completely hand in hand then.
Absolutely essential.
So what specific areas within healthcare, the operations, the management, are most affected by this digital wave, according to the research?
The sources detail quite a few key areas. It definitely impacts how strategy itself is created and how organizational structures might need to change, become more agile. It's obviously essential for managing and allocating resources judiciously to get those efficiency and quality gains that are needed.
Right.
It underpins that new patient-centered philosophy we talked about. It actually enables concepts like co-production and co-creation of value, where patients become active partners in their care.
Co-production, co-creation.
Yeah.
Interesting.
It also provides much better ways to monitor and understand the flow of activities that professionals are undertaking. It's crucial for enabling the shift towards personalized medicine, tailoring treatments based on individual data, and critically, it drives the need for continuous, permanent development of knowledge within the sector, just to keep pace with the relentless speed of change.
That's quite a comprehensive list of impacts. Now, healthcare is a unique professional environment, isn't it? High skills, autonomy.
Very much so. Professional bureaucracies, often.
So does that create specific, perhaps particularly difficult people management challenges in this digital age?
Yes, the sources explicitly pull out some critical challenges. One is the persistent threat of talent scarcity.
Talent scarcity, even
Yeah.
in healthcare.
Yes, because the digital shift demands new skills, new competencies, digital literacy, data analysis skills, complex problem solving, but in virtual settings now. These aren't always things that traditional healthcare education has fully caught up with yet. Plus, there's this constant need to seek out, incorporate, and really leverage both tacit knowledge, that hard-won experience, the stuff that's difficult to write down, and explicit knowledge, the codified stuff, in guidelines and documents. You need both to build the intellectual capital required to thrive in this new environment.
Okay, so getting the right skills and managing both types of knowledge. What else?
Another major challenge is navigating what they call value-based healthcare volatility.
Volatility. What does that mean here?
Well, the sources use the COVID-19 pandemic as a prime example. It showed the absolute necessity for rapid adaptation, for flexibility under immense pressure. Healthcare is an environment, let's face it, with a very limited margin for error and often high costs associated with experimentation.
True. You can't just try things out easily.
Precisely. And that reality makes building really cohesive teams and ensuring truly effective communication across different disciplines absolutely central to managing unexpected crises and driving necessary change successfully. Virtual teams and networks also become much more important for that flexibility in communication, including enabling remote working where it makes sense.
Right. So adaptability and communication are key under pressure. Any other major challenges?
And finally, there's the challenge thrown up by the dematerialization of processes and jobs, along with the increasing virtualization of services.
Dematerialization, meaning things becoming less physical.
Exactly. As technology gets woven deeper into the fabric of how care is delivered and managed, it becomes absolutely imperative that all users are digitally enabled. Whether that's the professionals delivering the care, the patients receiving it, or even citizens just accessing health information. Everyone needs the skills and the confidence to use the technology effectively. This is seen as essential for moving towards what some are calling Society 5.0, where technology serves human needs more seamlessly.
So it's ensuring everyone has the skills, teams can adapt quickly, and digital literacy becomes universal. That's a tall order.
It is.
What role, then, do things like communication and leadership play in actually navigating these human challenges successfully?
The sources really underscore their absolutely critical importance. Communication, in all its forms, formal, informal, internal, external, is seen as fundamental. fundamental to identity within the organization, fundamental for building the necessary relationships.
And leadership.
Leadership is highlighted as the essential link between the strategy and the structure needed to deliver it. Leaders have to be agents of change. They need to drive innovation, foster a culture of active learning.
What does that look like in terms of leadership skills?
Well, it requires leaders to develop new competencies. On the relational side, they absolutely need to build trust, practice authentic communication, support individual and team growth. And on the more technical side, they need the courage to challenge the status quo, they need to foster creativity, and they need to build networks inside and outside the organization to ensure it stays constantly updated and responsive in this fast-changing world. The sources suggest the leaders who will thrive are adaptable, maybe even a bit disruptive, focused on integrating different forms of value and creating value for society as a whole.
It sounds like a very different type of leadership is needed, not just managing, but truly leading transformation.
That's a good way to put it.
Now, it's clear the human side is incredibly complex. You mentioned monitoring and managing the flow of professional activities earlier. Let's pivot now to managing flows more broadly in healthcare, thinking about both the physical stuff and the patient journeys.
Right. And the sources helpfully clarify some terms here. They distinguish between logistics, operations management, supply chain management within healthcare. And then they make a really crucial distinction, which is key to understanding healthcare ops. The difference between tangible supply chains dealing with physical products and intangible supply chains, which are fundamentally about managing the flow of patients.
Okay, let's tackle the tangible side first. The medicines, the equipment, all the supplies. What does managing that actually look like in a hospital?
Well, tangible logistics in healthcare involves a pretty complex sequence of activities. You've got planning demand, ordering supplies, receiving the deliveries, managing stock, whether that's in big warehouses or just on the wards, then picking items for specific procedures or patients, distributing them to the point where they're needed, administering them if it's medication, and even managing reverse flows, things like return medical devices, expired drugs, or clinical waste.
Reverse flows. That sounds complicated too.
It can be. And the sources highlight some key challenges overall. Demand is often really unpredictable. You're managing hundreds, maybe thousands of different items, from cheap disposables to very expensive equipment. Some things are perishable, like drugs, and those reverse flows often have very specific handling rules.
Has managing all this physical stuff always been a top priority in healthcare? It feels like the clinical side usually gets the focus.
That's an interesting point the sources touch on. Historically, compared to, say, manufacturing or retail, tangible logistics in healthcare was often seen as just a supporting activity, almost an afterthought to the real work of clinical care.
Right.
However, there's a definite growing recognition now that efficient, tangible logistics is absolutely vital, not just for cutting costs, although managing inventory and waste better can save a lot of money, but also for ensuring the timely and adequate delivery of care right there at the bedside. If the right supplies aren't available when a clinician needs them, patient care directly suffers.
Okay, so getting the physical stuff sorted is crucial for efficiency and patient care. What about the intangible flow then? The patient themselves moving through the system. That seems inherently more complex.
This is where that concept of the intangible supply chain comes in. And frankly, where the social complexity really becomes apparent. Patient journeys aren't managed by one single department, are they? They cut across interconnected functional units, multi-professional teams, what the sources sometimes call microsystems. Those small, frontline care units where patients and providers interact.
Okay.
The flow units here are the patients themselves, along with their information, samples, test results, everything that travels with them. And the goal is to manage this flow effectively to ensure a smooth journey for that patient through diagnosis, treatment, recovery. This requires really robust process models that describe the structure, clearly define roles and responsibilities, and clarify how resources connect across all those different teams and departments.
And how does the research suggest hospitals can actually improve this patient flow management in practice? What are the steps?
Well, the sources outline a fairly practical step-by-step approach. First, identify the most common and strategically important patient processes, those journeys, where the organization really needs to create the most value.
Makes sense. Focus on the key pathways.
Second, establish the necessary infrastructure. Define roles clearly. Who owns the process? Who manages the resources? Form working groups. Ensure a vital support like IT and data systems are properly set up to measure and track these flows. You can't improve what you can't measure.
Sure.
The third step is absolutely critical. Deeply understand the process itself. What are its characteristics? Where are the current bottlenecks, the delays, the inefficiencies, the problems? What demands are being placed on it?
Yeah.
Based on that deep understanding, you then initiate continuous improvement efforts. And this is where the human element is vital again. Crucially, involve the coworkers who are actually doing the process every single day. They have the deepest insight, they know where the problems are, and they are key to implementing solutions that actually work.
Get the frontline staff involved.
Absolutely. Finally, establish development plans. Set clear goals from multiple perspectives: availability of the service, quality of the care delivered, cost efficiency, the time it takes for the patient journey, and of course, patient safety. And these plans need to be reviewed and updated regularly.
Okay, that framework sounds logical enough. Map it, measure it, involve staff, improve it continuously, yet.
Yeah.
The sources pose this really interesting question. Why do these recurring problems like long queues, treatment delays, high bed occupancy, why do they persist in so many healthcare systems, even in well-resourced countries?
Yeah.
Despite knowing these management principles and having technical solutions available, what are we missing?
This leads to a really profound insight from the sources. They introduce what they call the social management view.
Social management view, okay.
They essentially challenge the idea that organizations are just purely rational machines, where people follow instructions perfectly, like cogs in a wheel. They argue, referencing various authors, that management initiatives often run into resistance, they get shaped by internal politics, they're interpreted differently by different groups, they lead to misunderstandings, and they often have unforeseen consequences. Simply applying a technical recipe doesn't guarantee you'll get the expected result. A doesn't automatically lead to B because human and social factors are always in play.
So it's not just about flawed processes or not having the right tech, it's the messy, complex social environment itself.
Exactly. The sources suggest a much more fruitful way to look at it is to view organizations as complex adaptive or responsive processes.
Complex adaptive systems.
Right. This view combines ideas from relational psychology, how people interact, form relationships, influence each other, with complex systems theory, which studies how interconnected parts behave in dynamic, often unpredictable ways. So, interactions between coworkers, between teams, between different professional groups, they're seen as these ongoing conversations where relationships are formed, patterns emerge, new practices develop. And crucially, what is talked about becomes pivotal, especially if those conversations lead to shared understanding, shared interpretations, and ultimately integrated action across different parts of the organization. But whether that happens, they argue, is heavily influenced by the organization's existing culture, its history, its power dynamics.
This sounds less like fixing a machine and more like, I don't know, gardening. Trying to cultivate a healthy ecosystem.
That's not a bad analogy, actually. And what specific weeds or social obstacles make managing patient flows so difficult in this garden?
Yes, what are the big hurdles?
Well, the sources highlight the challenges caused by different languages or discourses within healthcare. For example, there's often a clash between the managerial discourse, which tends to focus on control, things like standardization, efficiency targets, resource allocation, and the clinical professional discourse, which focuses more on care or cure individual patient needs, clinical judgment, professional autonomy.
Control versus care cure. I can see how those would clash.
They often do.
Uh-huh.
These different perspectives can lead to conflict, misunderstandings, and ultimately disrupt the smooth flow of patients. The sources even mention potential conflicts between cure just treating the disease and care, looking at the whole person, holistic support. They also specifically mention the issue of professional autonomy and bargaining power, particularly among physicians.
Ah, the autonomy point.
Yes, this can make managers quite hesitant to confront situations where established guidelines or process steps, perhaps designed for efficiency or standardization, aren't being followed. They might worry about alienating key staff members. There's an example cited where managers deliberately avoided confronting a physician who wasn't adhering to process guidelines simply because they were concerned that physician might leave. It shows how relational dynamics can completely override the technical rules sometimes.
So if top-down control doesn't always work, and you have these conflicting perspectives and power dynamics, how do the sources suggest we overcome these social hurdles to actually improve patient flow?
A key strategy proposed, which I find particularly compelling, is using the patient as an attractor.
The patient as an attractor. Explain that.
It means positioning the patient's needs, their experience, their journey, as the central unifying force for dialogue and collaboration, bringing everyone together around the patient. So if you focus discussions specifically on improving a particular patient process, it creates a sort of neutral ground. an arena where representatives from management, different medical specialties, nursing, pharmacy, support services can all come together. Together they can discuss and, crucially, balance those different, often competing perspectives. What does the patient need? What are the safety issues? What are the medical requirements? What are the resource constraints? By centering the conversation firmly on the patient, it helps bridge those different languages we talked about and encourages integrated, collaborative problem solving rather than siloed thinking.
Using the patient as the common ground to force collaboration, that makes a lot of intuitive sense.
It does. Though the sources also acknowledge a practical barrier that often gets in the way of this.
Oh, what's that?
Top management often demands excessive amounts of detailed information and reporting from clinical managers, burdening them with paperwork.
Right, bureaucracy.
Exactly. And this steals precious time that those managers could, and probably should, be spending actually present in the clinical units, close to the patient flows, observing processes directly, engaging with frontline staff. That presence is essential for understanding the real issues, fostering trust, and facilitating that continuous improvement dialogue.
So managers get stuck behind desks filling out reports instead of being on the ground.
That's the concern raised. However, the research suggests that scheduling dedicated time specifically for development activities is possible, and it's necessary for driving that continuous process improvement. And also that involving the professional groups directly in relevant managerial decisions is crucial for getting their buy-in and properly leveraging their expertise.
Okay, so protect time for improvement. Involve the clinicians. Makes sense. Now let's circle back to the technology itself. We've talked strategy, people, flows. Let's look at some specific applications, telemedicine, AI, and really consider their impact, particularly on the human experience.
Right. And the sources revisit how digital technology is framed as healthcare 4.0, applying Industry 4.0 ideas to health, are enabling this fundamental shift we've been discussing. They allow that move from the traditional delivery model to one that's potentially more accessible, more flexible, more patient-centered, and they also provide tools for managing those tangible resources more efficiently.
What are some of the concrete examples of these technologies being applied in healthcare settings that the sources mention?
Several key ones are highlighted. You've got Internet of Things, IoT devices, think remote patient monitoring, wearables collecting data, big data, which we touched on, for analyzing patient journeys, supporting telemedicine. Cloud computing is crucial for enabling remote data access, powering telehealth services. Blockchain is mentioned for its potential in enhancing data security, traceability, and maybe managing digital identity in a way that puts the patient, the human, back at the center of their own medical data.
Blockchain for health records. Interesting.
And they also touch upon the potential for AI-enabled robots to support intelligent operations within hospitals or labs. But a really key point made is that getting the full benefit, achieving that smart hospital vision, requires successfully integrating these diverse technologies. They can't just be implemented in silos. They need to work together.
Integration is key. Now, telemedicine is one area that absolutely exploded, particularly during the pandemic, didn't it?
It really did.
How do the sources discuss its role and impact?
Telemedicine is presented as a prime example of a digital technology application that was massively catalyzed by COVID-19. Its expansion across so many medical specialties was really unprecedented. And the benefits are pretty well recognized now. Enhanced access to care, especially for people in remote areas or those with mobility problems. Improved resource efficiency, it can reduce the need for a physical clinic space, maybe optimize staff time compared to in-person visits, potential cost reduction, and also potentially reducing patient anxiety or fear sometimes associated with going into a hospital.
Those are clear advantages. And the expectation is that virtual visits are here to stay.
Yes, according to the sources, the expectation is that virtual consultations will remain a significant part of how healthcare is delivered, even post-COVID.
Okay, so clear benefits. But does shifting so much interaction into a virtual environment introduce new kinds of challenges?
Oh, absolutely. And particularly, the sources argue, in the realm of knowledge management.
Knowledge management, how so?
They raise a really fascinating point. Virtual environments pose distinct challenges for how knowledge gets translated, transferred, shared, and even created. Specifically, they argue it makes it much harder to convey tacit knowledge.
Tacit knowledge, that's the unspoken stuff, the experience.
Exactly. That deep, experience-based understanding that's often unwritten, hard to articulate, and best transmitted through things like observation, demonstration, shared stories, working side by side, the kind of learning that happens through nonverbal cues. How do you effectively teach a subtle clinical examination technique over video? How do you truly convey empathy? How do you accurately sense a patient's underlying emotional state when you're just looking at them on a screen? It's much harder.
That's a really critical challenge, especially in healthcare, where so much relies on observation and intuition. Does the research offer any insights into how organizations are trying to tackle that in a virtual setting?
Yes, they actually detail a very relevant case study. It's from the National Cancer Institute of Aviano in Italy, their D@H initiative, which stands for Domiciliary Assistance in Oncology, Home-Based Cancer Care Support. And this project specifically focused on two aspects that are perhaps understudied but essential for making telehealth knowledge management work: service co-production and continuous learning.
Co-production and continuous learning. Tell me more about those in this telemedicine context.
Okay, so service co-production here is about actively engaging the patient as a partner in their care, not just a passive recipient. Because physical contact was limited in this D8H program, the doctors and patients had to collaboratively figure out new ways to communicate symptoms, treatment side effects, general well-being, all remotely. The clinicians actively guided patients in this, empowering them to become better contributors of information, active participants in managing their own health from home.
So, patients taking a more active role out of necessity.
Exactly. And continuous learning refers to the ongoing process for both the clinicians and the patients to adapt to this new way of interacting and managing care virtually.
Mm.
Everyone had to learn together.
Mm.
And the preliminary findings from this initiative, according to the sources, suggest that by actively focusing on co-production and co-learning, you significantly enhance patient participation. You improve that difficult knowledge translation in the virtual setting, and you actually strengthen the interaction between clinicians and patients. It helps maximize the benefits of telemedicine.
So it requires deliberate effort from both sides to make that connection and knowledge flow work remotely. It's not automatic.
Precisely. It's not just implementing the tech. It's actively cultivating new ways of interacting and learning to preserve that partnership and knowledge transfer.
Now, beyond these practical challenges of knowledge transfer, the sources also touch on what sound like quite profound psychological consequences of all this increased digital interaction.
Yes, they raise some quite deep points here, actually. The shift towards digital interaction. Well, it makes physical presence less necessary, obviously. But it doesn't automatically keep people feeling genuinely close. They discuss how communication can sometimes become more superficial online. And a key concept mentioned is the challenge to our corporeality, our sense of being embodied, our physical experience of the world and others.
Corporeality. How does digital interaction challenge that?
So much of human interaction relies on subtle, often unconscious, nonverbal cues, doesn't it? Posture, breathing patterns, tiny facial expressions, maybe even things like scent. Digital interfaces inevitably filter out or completely eliminate many of these cues, and that fundamentally changes the nature of the connection, the quality of the presence.
That really makes you stop and think about what might be getting lost in translation, doesn't it?
It does. And the sources delve into some potential negative psychological consequences, too. They discuss phenomena like developing an intimacy with machines, maybe an over-reliance on or a blurring of lines between human connection and digital connection. They mention potential new tech-induced mental habits, a craving for quick excitements, maybe leading to sudden disillusionments when immediate gratification isn't met, a difficulty tolerating delays, perhaps a tendency to live at a distance from immediate reality by seeking refuge in the digital world, and even being sort of programmed for speed and instant reactions rather than slower reflection, a deeper thought. These are subtle but potentially quite pervasive impacts on our mental landscape.
Those are quite sobering thoughts about the potential downsides.
They are. And beyond the purely psychological, the sources also flag broader challenges in digital health. Things like complex legal issues around jurisdiction, whose rules apply when care crosses regional or national borders online. The need for consistent regulation. They really stress the urgent need for training professionals properly in these new ways of working, citing, for example, psychologists needing specific training to deliver telepsychotherapy ethically and effectively. And managing crisis situations remotely, that's inherently riskier. It requires professionals to be exceptionally well-trained to identify warning signs and respond appropriately without being physically present.
And ethical concerns.
Yes, ethical concerns are definitely raised, particularly the vulnerability introduced by the anonymity that online environments can sometimes facilitate, which could potentially lead to abuse. And patients are also vulnerable regarding the privacy and secrecy of their sensitive medical data when they're contacting professionals online. Computer security is paramount. The sources advocate strongly for more interdisciplinarity, even transdisciplinarity, in tackling these challenges. They reinforce this idea that human health outcomes aren't just simple biology. They're the complex result of interactions influenced by behavior, emotions, lifestyle, managed by parts of our DNA previously dismissed as junk, but which actually respond to our environment and experiences. It demands a truly holistic perspective.
A holistic view where tech, mind, body, social context are all inseparable.
Exactly.
And I think there was also just a brief mention of how these digital tools impact the professional's own work lives directly.
Yes, that's right. One study referenced, looking specifically at workers in Portugal, highlighted that the rise of telework, enabled by all these digital tools, introduces its own set of human factors challenges for the professionals themselves. Things like navigating the complexities of balancing work and family life when the boundaries are blurred, and managing occupational stress in that more fluid environment. So the digital shift doesn't just impact care delivery, it fundamentally changes how healthcare professionals structure their own working lives too.
It really drives home how this transformation touches every single facet of healthcare, right down to individual well-being for both patients and staff. Okay, finally, let's look at how success is actually measured in this evolving landscape, specifically focusing on perceptions of quality. How do we know if we're doing a good job?
Well, quality and access are obviously the non-negotiable foundations for any healthcare system. And the sources explain that quality management isn't really about reaching some fixed endpoint. It's an ongoing journey, a process of continuous improvement driven by systematic management models. Measuring quality is seen as a continuous stimulus for improvement. And understanding how the actual users, the patients, evaluate the services they receive is absolutely vital for guiding reflection and driving meaningful change.
So patient evaluation is key. Now, the sources present findings from a study that looks specifically at customer perceptions of quality using the Survey-Qual model. What were the main takeaways from the patient perspective there?
Right, this study used a quantitative survey approach, surveyed over 100 customers, and used linear regression analysis to see what predicted their sense of reliability. And the central finding regarding customer reliability, how much patients trust that the service will perform dependably and accurately, was particularly insightful. The study found that two factors had a positive and statistically significant impact: tangible aspects and staff interaction.
Tangible aspects and staff interaction. Can you unpack those?
Sure. Tangible aspects refers to things like the appearance of the hospital facilities, the equipment used, even the appearance of the personnel, the physical environment they encounter. Staff interaction covers how staff engage with the patient, their ability to communicate knowledge clearly, their perceived empathy and helpfulness, the human touch. And the analysis showed that both of these, the physical environment and the quality of human interaction, were almost equally important predictors of whether a patient perceived the service as reliable.
So for patients, reliability isn't just about whether the clinical procedure worked. It's the whole package. The place looks right, and the
Yeah.
people treat you well and communicate effectively.
Exactly. It really underscores that for patients, trust and confidence are built on both the physical setting and that crucial human connection.
That's a really powerful takeaway. How does that compare then to the perception of quality from the employee's point of view? Is there a different perspective internally?
Yes. Another study presented in the sources looked at exactly that: employee perceptions of service quality. This was done in a specific hospital sector that used graphic methods for analysis. They used a combination of Survey-Qual, but framed it using a 4Ps model profile, the visual aspects, process, the actions involved, procedure, the documented steps, and people, staff interaction motivation. And they combined this with a method called the analytic hierarchy process, or AHP, to help prioritize factors. They surveyed about 27 employees, nurses, doctors, receptionists. So a smaller, more focused study, but offering that valuable internal perspective.
Okay, using AHP for prioritization. And what did these employees identify as most crucial for delivering service quality?
Well, from the employee's viewpoint, using that AHP method to weigh up all the different factors, the single alternative that came out with the highest global priority was training, alternative B in their model. It had a significantly higher priority weight than other factors, making it the most important thing identified by the staff themselves as driving quality. While things like improving the physical layout were seen as important locally for the profile aspect, the overarching message from the frontline staff in this study was crystal clear. Investing in training was perceived as the most critical lever for improving service quality overall.
Wow, that's a fascinating contrast, isn't it? Patients looking at the tangibles and the interaction for reliability, while the staff delivering the service point to training as the absolute foundation for quality.
It really highlights the different lenses through which quality is viewed, and perhaps what different stakeholders believe are the most effective levers for improvement. For the employees in that study, the conclusion drawn was that investing in their development, building their skills and knowledge through effective training, is seen as directly enabling them to deliver high-quality services. And that's paramount in healthcare, given the high stakes and complexities involved. It strongly suggests that if you want improved quality from the inside out, focusing on properly equipping your people through training is absolutely key.
This deep dive has truly unpacked so much, hasn't it? The multifaceted transformation that's underway in healthcare. We've gone from that strategic vision of tech-enabled smart hospitals, looked at the immense pressures driving that change, through the really radical shifts needed in people management, this idea of HRM 4.0, and explored the complex, often deeply social challenges of managing both the physical supplies and those intricate patient journeys. We've seen how digital technologies like telemedicine offer just huge potential, but also introduce these profound human and psychological complexities, demanding new approaches like co-production and continuous learning.
Indeed.
And finally, we've gained such valuable insight into what really matters for quality from those different perspectives, the vital importance of tangible environments and staff interaction for patients, and that crucial role of training for the professionals delivering the care. Listening to all this, it seems clear that as healthcare becomes ever more digital, ever more data-driven, perhaps the real challenge isn't just building smarter technology, but actually cultivating the human intelligence alongside it. The communication, the adaptability, the trust, the empathy, all the things needed to wield that technology effectively for truly patient-centered care.
A very pertinent thought to end on.
If you found these insights valuable today, please do take just a moment to rate and share this deep dive. Thank you so much for expertly guiding us through what is an incredibly complex but absolutely vital landscape today.
It's been my pleasure entirely. It's certainly a transformation that demands our careful consideration, balancing both the technical possibilities and that enduring essential human element.